The CDC reports that hospitalization rates for Latinx people is about 4 times higher than it is for non-Hispanic whites. What's going on? And what can be done about it? Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, senior writer with AHA. In 2018, AHA formed a strategic alliance with UnidosUS to focus on building stronger, healthier communities. In this conversation, Elisa Arespacochaga, interim executive lead for the Institute for Diversity and Health Equity and vice president of AHA's Physician Alliance, is talking with Rita Carreon, Deputy Vice President for Health, UnidosUS. Elisa and Rita explore the health inequities in the Latinx community, with a focus on the COVID-19 pandemic and the upcoming flu season.
Good morning. Today I'm excited to be joined by Rita Carreon of UnidosUS, who has worked closely with the AHA through our strategic alliance to help build healthy, equitable, and resilient communities. Thanks for joining me this morning. Let's start with a little bit about the history of UnidosUS and your role at the organization.
Elisa, thank you for inviting me to chat with you today. I'm super excited to have this important conversation, which, as you know, comes at a very pivotal time for our country. UnidosUS, which is formerly the National Council of La Raza, or most of us knew it as NCLR, we've been in existence for over 50 years, and we are the largest national Hispanic civil rights and advocacy organization working to increase opportunities for the nation's 60 million Latinos. And how we do this, we leverage our unique assets on policy and programs in the areas of education, immigration, economic empowerment, housing, and health. And along with our affiliate network of nearly 300 community-based organizations located in 37 states, DC, and Puerto Rico, we seek to achieve transformational change that will build a stronger and more equitable America for all. One of our mission is to work, and our work has never been more important, with the pandemic and the economic crisis that continues to unfold. You've seen it as well. We're seeing a very stark truth being increasingly laid bare. One of the things in terms of my role of leading our health work at UnidosUS, my team and I, in collaboration with our marketing and communications teams, have been leading our public health response to the COVID crisis, with a focus on helping our affiliate network address its disproportionate impact on the Latino community and to inform the general community. And so this effort has a community-centered approach through listening sessions and individual calls and a needs assessment among many leaders, including, our promotoras de salud and community health workers. So it's just a little bit about kind of some of the work that we've been doing lately, and happy to go into it a little more deeper with you.
Great. Really appreciate it. And I'm so glad that our partnership continues. And I'd love to have you share a little bit with our audience about how UnidosUS and its affiliates really work with hospitals and health systems to address some of the healthcare disparities that we're seeing, especially now as it relates to COVID. But I know there's a long history of those partnerships.
Yeah, thank you. I think that through this alliance with the American Hospital Association and Unidos, we work together to ensure that healthcare evolves to better understand and address the changing needs of our communities. And I think one of the reasons why our alliances work really nicely is that we're both committed to fostering leadership and advocacy on key health issues for Latinos and really creating a meaningful access to health and healthcare for our communities. And some of the things that we've been doing is really championing our community assets and their capacity of not only our affiliate networks, but hospitals and health systems, because I think both organizations believe that we can see a stronger America where economically, politically, social advancement is a reality for all Latinos. And so one of the things that both organizations, through our alliance, is that we understand that it's critical that hospitals and health systems leadership reflect the growing diversity of their patients and staff and of our country. And so through our Trustee Match program was one way that we can do our part to elevate not only voice and power, but also representation in the boardroom and in the Community Advisory Council network. And so that's just one part of that. The other one is through working with our community-based organizations and the hospitals. As you know, CBOs or community-based organizations provide an array of services to millions of Latinos and others every single day, just as hospitals do. And so the supporting organizations really recently have been on the front lines, just as hospitals have been, in really helping our community cope with this crisis, but also with often, adequate funding and resources, especially given the need and the demand. So collectively, we see that this collaboration has been first and foremost in even addressing mental health needs. Even before COVID happened, some of our affiliates have been working with, a hospital in Chicago to help support mental health needs, increase access to healthy food in other communities, and elevating the strength of even community health workers. And as you know, community health workers or promotores are that continued trusted resources. And so being able to generate that trust and guidance, not only within our CBOs, but also our health system, is how we can really work better together for our communities.
Absolutely. I couldn't have said it better. Let's dig in a little bit on some of the challenges that our organizations really still face. And I know you and I have talked in the past about these issues, and recent articles have really been highlighting in polls. There is a certain level of fear and mistrust of healthcare organizations that may prevent some of the Latino community from really seeking needed medical care. How can we help our hospital and health system leaders, our AHA members, really address some of those concerns? Do you have some advice for them in terms of some steps they can take to build that trust and really connect with their community, especially now?
Yeah, I think one of the biggest things that some advice for hospital and health system leaders is in terms of really understanding the Latino community, and even more so now than ever before. Even before COVID, and I keep coming back to COVID because it's the heart and the center of just our reality right now, right?
Mm-hmm.
Even before that, there has been really a growing mistrust in systems and government and just really fear, largely because of anti-family policies like the public charge have made many Latinos fearful of seeking health care and economic support. They're avoiding health assistance and programs of which they are legally entitled out of fear and confusion around really aggressive anti-immigrant policies. One of the studies that we had seen, health experts found that Latinos enrolled into the Supplemental Nutrition Assistance Program, which is often called food stamps, dropped by 10% in 2018, even as food insecurity among Latino families rose. And this is before the pandemic. And even now I've seen studies where Latinos are at a higher growing risk of going hungry each night because of the lack of jobs and healthcare. And so I think one thing that hospitals and health systems have an opportunity is really to expand where health happens, meaning seeking now more than ever, and I know that many have community advisory panels and have been supportive of community health fairs and things like that. But I think it's super important now than ever to really seek out community leaders and organizations as trusted messengers that are really critical levers to engage. They're very important elements in terms of investments in services that will increase patient engagement, such as what I mentioned earlier in terms of food insecurity or housing support, or even childcare and language supports. And I know that some of these systems exist within a hospital network, but how do you think about it when you're looking at your finances to really think about, in order to stand and breathe in a community and thrive in a community, these investments continue to be just more important than before, and not to be the first things in terms of blocking or, stop any type of investments, right? The other thing that I think is that transparency in the data that is collected on race and ethnicity and language, and monitoring, reporting, and kind of that intersection of how that looks like with the quality measures and performance that a hospital system is looking at. What I'm saying is not to underestimate the value of data in being able to be more focused in your approach and being able to assess where individuals sit at and where they can be able to help inform better decisions for an administrator. I think that's just as important. And being able to be transparent about it. I think our community wants to know, how we are all doing and recognizing that their own experiences are not only validated, but that people are taking note in the importance of having resources allocated for that community. And then the third thing that I do want to say is I know that hospitals and health systems have been, cross-cultural training or what is often called as cultural competency training, right, of staff, to be able to better understand and take these steps to have a trusted and safe space. But I think we need to go beyond that. I think we need to hold these honest conversations to elevate not only the importance of our community, the value assets that we bring, but the diversity, the equity, the inclusion, and the sense of belonging, not only within your walls across departments, but also within the communities and having those listening sessions. I think one way you can gain trust is to be there and to listen and to support and to learn. We've taken this approach as an organization for a number of years. That's kind of where equity is the heart of what we do. When the pandemic started to come into fruition, we knew that this was going to unveil much more structural racism and barriers and inequities that we were seeing. But one of our approaches that we did is to go to our community-based organizations, go to our promotoras, go to our housing counselors, go to our education leaders and teachers and say, what is happening? Where are you? How can we support you? And the result of that was our Esperanza Hope Fund. And that was very specific in how we were going to message the information on the public health response, but also how we were going to support CBOs that were having an increased demand for services, but having challenges in keeping their doors open. And then at the ultimate, when we look at advocacy and policy, that was also helping us to understand the importance of what our voice is when we go up to the Hill or to Capitol Hill or to our state governments in terms of making sure that all policies are inclusive. And I think in those actions is how you start to create trust. You have to look at what supportive measures that we need to have in place for more equitable, inclusive policies, to take critical positions against policies that further disenfranchise our communities. And I think that is where you start to be able to see change and be proud of your own values and assets that you already bring to the community.
I think that's wonderful. One of our members refers to it as cultural humility training, which I really would like to adopt going forward, because I think it is about being open to listening and hearing what it is that others need. I think that's a great approach. Thank you for sharing how you've been doing that. And speaking of data, I know the reports that are coming from the CDC, limited data on some of these, but we're really seeing some hospitalization rates among Latinos that are 4 to 5 times higher than those of non-Hispanic whites. It's even worse for other groups. Where are you seeing the places where we can try to help address some of this staggering disparity?
Yeah, thank you for bringing that up. And I know that many hospitals and health systems are seeing this type of data firsthand, right? And nationally, while Latinos make up about close to 19-20% of the total U.S. population, we're seeing that Latinos represent about 30% of all COVID cases in the U.S., of which data that we actually have available, of race and ethnicity data. And that's the kicker there, right? We don't have full, accurate, precise data on the race ethnicity of our communities. We know that Latinos are making up about 16-17% of the U.S. COVID-19 deaths. And even tragically, Elisa, among our Latino children and youth, they're also getting sick and dying from COVID-19 at one of the highest rates among children. Close to half of all confirmed cases in children between the ages of 5 to 17 are Latinos. And about 32% are those of cases in youth, the 18 to 29. We're a very young population, but it also comes with a lot of disparities and historical structural barriers that have limited our ability to be healthy. One of the things in terms of what I believe that are some of the primary reasons is not just aside from the physical potential comorbidities, as you mentioned, even the young kids that are getting sick, is really our communities are on the front lines. They're making vital contributions to our country's ability to function, such as providing health care, helping people put food on the table, delivering other essential services. And at the same time, they're among one of the most vulnerable in getting sick and dying. And so Latinos are really overrepresented in essential jobs, which places them at higher risk of exposure. We're seeing this in the industries like agricultural industries, the food processing, the meat packing industry, transportation, which are powered by Latinos. And so despite being essential to our country's health and safety, these occupations often pay very low wages. And they don't offer basic protections like paid sick or family leave, and it allows workers to self-isolate if you get sick or if you care for, an ill loved one. That sometimes is much more difficult, especially in the housing conditions. You also see that, in the disparities, there's a number of uninsured Latinos that are rising. Even before the pandemic, we were seeing a huge increase starting to come off of health insurance, largely because of fear or media or this sense of not wanting to be counted, I guess, in one sense, right? Because of the administration with the public charge, right? And I think we've seen that many Latinos have lost employer-sponsored coverage, especially since March due to layoffs, and these rates are increasing. So this disparity exists in a lot of different ways. It has exacerbated the food insecurity of Latino households, especially those of mixed status homes. And it also the lack of a sense of, especially early on when we were seeing this, is whether there was free testing for COVID that could benefit Latinos. And it wasn't sufficient, or people are feeling, if I were to get tested positive, can I afford the treatment? Would I be, asked to pay for something that I just am barely making it on my own? And so there's a number of different structural, separate from the physical aspects of why we're seeing these types of disparities happen.
Absolutely. Well, and now that we're rolling quickly into the fall, more than ever, we need to be helping our communities stay healthy, protect themselves and others from COVID-19. And with the flu approaching, my arm is still sore from my own flu shot.
Yeah.
Encouraging people to get the flu shots. How can our members, our hospitals and health systems really work with their community-based organizations and organizations like Unidos to increase the awareness and encourage that kind of prevention, obviously within light of everything you just covered of, they're on the front lines and there are Latinos who can't be working in their homes and protecting themselves in that way. So how do we encourage people to stay safe and wear a mask and all of the things that we've talked about, as well as protecting themselves from the flu?
Yeah, I think it's now more than ever. You absolutely said it right. It hit it there in terms of this confusion about with the flu season approaching. If an individual were to get sick, what does that look like? And I think collectively we need to ensure that there's timely, accurate, science-based information that is provided in a language that communities can understand and they can activate with. And we need just a major campaign, really help increase awareness and encourage these preventive measures to be taken. We're starting to hear from our communities that they don't even want to take the flu shot because of just fear of government or fear of what does this look like? What are the potential consequences of it? And I think a lack of information can really spin off to a lot of misinformation and myths or unfactual kind of scenarios. So I think it's super important now that we really try to ensure that our communities are aware about the safety of getting a flu shot, the safety of eventually coming down the pipeline for a vaccine, remove barriers that keep our communities from accessing preventive services. Is there a way that we can do pop-up sites for accessing free flu shots out in the community, going to the work sites to be able to do that? I think that's some of the innovative approaches that happened before, but with the pandemic, it's much harder. I know I needed to make an appointment to go get my flu shot, and these are appointments that are far and few in between at times. And so the access and the convenience of being able to do that, I think, is important. And for people to understand that being protective, especially during this time, is super important. Of the continuance of washing your hands and staying home if you're sick, if you're able to, right, is going to take a lot of very constant, consistent messaging that communities can understand. It has to be simple and clear, and in the language that an individual understands.
Absolutely. And I know Unidos has been a great partner in spreading some of the PSAs that we have been working on with other associations, including the AMA and the ANA, the Medical Association, the Nursing Association, which I know have been done in several languages. So we really appreciate the partnership, and we're working on continuing that in terms of the flu and then down the road on the vaccine. But I think helping hospitals understand that we need to be as clear as possible and make it as easy as possible. So to wrap us up, what advice would you give to our members as they're really looking for ways to foster the health and wellness and connection to their Latino communities?
Yeah, thank you. I think with 60 million strong, the Latino or the Latinx community are really the key to U.S. recovery. But this pandemic, as you know, has unveiled a lot of socioeconomic inequalities and limited their ability to lead healthier lives. And so I think it's no better time now is to really to show up for and to invest in our communities, to invest deep and wide, to think outside the box of kind of how can you not only be a partner, but also listen to where the most needs are. I've seen this firsthand with a lot of our community-based organizations where we're separate from, I don't need this, but I do need diapers and I do need food. And so these are things that you kind of have to really be able to be self-aware about where your intentions are, but also making sure that you're listening to the community. I think the other thing also is that representation matters. Ensuring that our community and a diverse voice is at the table, not only when making decisions that can lead to unintended outcomes, but also in mentorship and leadership development, such as speaking roles, where Latinos can share their stories and help shape a much more positive narrative of who we are and our contributions to society. So I personally want to thank you, Elisa, for having me on this podcast to be able to tell not only the story of our communities that we serve, but also the importance of how can we be part of the solution to a better economy, a better health environment and community. And then the third thing that I would like to leave you with, just because it's so strong in who we are as an organization, but I think extremely important during this time is really to support efforts that make it easier to become a healthcare voter. I think if you aren't already providing time for your staff to vote, to do so easily, do consider hosting a voter registration drive or a phone bank option or something that encourages people to register early and to vote. And I think there's ways that our hospitals and health systems have a major role to take in that place, where ideally you probably have been in the past, right? And it's probably been left to a lot of the voter organizations and things to really encourage. But I think being civically engaged and being that healthcare voter really matters now more than ever. 32 million Latino citizens are projected to be of voting age in 2020. And Latinos have the power to be a strong, decisive voting force. And Latino voters want leaders who value diversity and bring people together. And so we know, and even from the polling that we've done with our work, is that healthcare continues to be one of the top, if not the top issue for Latinos and what we care about. So do not underestimate the power that you can be able to have in terms of the space and a safe space to be an advocate for health, but also encourage not only to vote, become a citizen, but participate in democracy. And so I think that's just as important this year.
Absolutely. And the AHA has just, in fact, kicked off our We Care, We Vote campaign, encouraging just that. So if you're listening in and want to get your teams set to vote, please check that out on the AHA website. Rita, thank you so much for joining me in what we hope will be a series of discussions about how we can work more closely together and how our hospitals can connect better with their communities. Thank you so much for joining me, and thank you for all the work that you do.
Thanks, Elisa.